Healthcare Administration Issue: Staffing Shortages in Ambulatory Healthcare. This presentation is based on an interview with a practice manager who oversees the daily operations of an outpatient healthcare practice. The interview identified staffing shortages and employee retention as one of the organization's most significant healthcare administration challenges. The practice manager explained that maintaining adequate staffing levels is essential for ensuring efficient operations, delivering high-quality patient care, and providing timely access to services. This presentation examines how staffing shortages affect healthcare organizations through the Iron Triangle model, which focuses on balancing cost, quality, and access to care. It also explores the factors contributing to staffing challenges and discusses strategies organizations can use to improve workforce stability and patient outcomes. During the interview, the practice manager identified staffing shortages and employee retention as one of the organization's biggest challenges. Recruiting and retaining qualified healthcare professionals has become increasingly difficult due to workforce shortages, increased demand for healthcare services, and employee burnout. When positions remain vacant, existing staff often work overtime or take on additional responsibilities, which can lead to fatigue, stress, and decreased job satisfaction. These staffing challenges also affect patients by increasing appointment wait times, delaying care, and placing additional pressure on the healthcare team. As a result, staffing shortages impact not only daily operations but also the organization's ability to deliver safe, efficient, and high-quality patient care. The Iron Triangle model is a framework used to understand the relationship between cost, quality, and access in healthcare. These three components are interconnected, meaning that changes in one area often influence the others. For example, hiring additional staff may increase costs in the short term, but it can also improve the quality of care by reducing employee burnout and lowering the risk of medical errors. It can also improve access by allowing more patients to be seen in a timely manner. On the other hand, reducing staffing to save money may lower immediate costs, but can negatively impact patient care and limit access to services. Healthcare administrators must carefully balance these three elements when making decisions about staffing and other organizational priorities. Staffing shortages significantly increase operational expenses for healthcare organizations. When there are not enough employees to meet patient demand, organizations often rely on overtime pay for existing staff or hire temporary agency personnel to fill staffing gaps. While these solutions help maintain patient care, they are typically much more expensive than maintaining a stable permanent workforce. In addition, recruiting, hiring, and onboarding new employees require considerable time and financial resources, including advertising positions, conducting interviews, completing orientation, and providing training. Staffing shortages also reduce productivity because employees may be responsible for additional duties, leading to fatigue, decreased efficiency, and an increased risk of errors. These factors contribute to higher operating costs and place additional financial strain on healthcare organizations. Staffing shortages have a direct impact on the quality of healthcare services. When there are fewer staff members available, employees often have larger workloads and may work longer hours, increasing the risk of fatigue and burnout. These conditions can contribute to communication breakdowns, reduced attention to detail, and a greater likelihood of medical errors. Staffing shortages can also lead to longer wait times for patients and less time spent with each individual during appointments, which may affect patient satisfaction and overall quality of care. Maintaining adequate staffing levels helps ensure that patients receive safe, timely, and effective care while supporting a healthier work environment for healthcare professionals. Staffing shortages has a significant impact on patients' access to healthcare services. When there are not enough healthcare professionals available, organizations may have to reduce the number of appointments they can schedule each day. This can result in longer wait times for patients seeking routine care, specialty services, or follow-up appointments. In some cases, procedures or treatments may be delayed because there are not enough staff members to provide care efficiently. These delays can be especially challenging for patients with chronic conditions or those who require timely medical attention. Healthcare administrators must work to balance staffing resources with patient demand to ensure that individuals can access the care they need without unnecessary delays. This chart illustrates how staffing shortages affect the three components of the Iron Triangle: cost, quality, and access. The ratings shown are illustrative and are intended to demonstrate the relative impact of staffing shortages rather than represent actual research data. Cost is rated the highest because staffing shortages often increase operational expenses. Healthcare organizations may need to pay overtime, hire temporary agency staff, and spend additional money recruiting, hiring, and training new employees. These factors place significant financial pressure on the organization. Quality is also greatly affected when there are fewer staff members available. Employees often experience heavier workloads and fatigue. This may increase the risk of medical errors, reduce the amount of time providers spent with patients, and lower patient satisfaction. Access is rated equally high because staffing shortages limit the number of patients who can be seen. Organizations may have fewer appointment openings, longer wait times, and delays in treatment, making it more difficult for patients to receive timely care. Overall, this chart demonstrates that staffing shortages impact all three areas of the Iron Triangle. Healthcare administrators must balance these competing priorities by investing in workforce recruitment and retention while maintaining financial sustainability and ensuring patients continue to receive high-quality, accessible care. Several internal and external conditions contribute to staffing shortages and influence the relationship between cost, quality, and access. Internally, healthcare organizations must work within budget limitations while recruiting and retaining qualified staff. High turnover, employee burnout, and scheduling challenges can make it difficult to maintain adequate staffing levels. When organizations are understaffed, remaining employees often experience increased workloads, which can further affect morale and productivity. Externally, healthcare organizations face nationwide workforce shortages, increasing demand for healthcare services, and an aging population that require more complex medical care. Changes in healthcare regulations and reimbursement policies can also impact staffing decisions by affecting an organization's financial resources. These conditions make it difficult for healthcare leaders to balance the three components of the Iron Triangle. Effective workforce planning, employee retention strategies, and strong leadership are essential for maintaining high-quality care while controlling costs and ensuring patients have timely access to healthcare services. To address staffing shortages, healthcare organizations should focus on strategies that improve both recruitment and retention. Recruiting qualified employees is important, but retaining experienced staff is equally critical because replacing employees is often more expensive than keeping them. Offering competitive salaries, comprehensive benefits, and opportunities for career advancement can help attract and retain skilled healthcare professionals. Organizations should also promote work-life balance by offering flexible scheduling and ensuring adequate staffing levels to reduce burnout. Providing ongoing training and professional development helps employees build new skills and feel more engaged in their work. In addition, wellness initiatives such as mental health resources and employee support programs can improve morale and reduce turnover. Strong leadership and effective workforce planning are essential for long-term success. Healthcare administrators who invest in their workforce can improve employee satisfaction, reduce operational costs associated with turnover, enhance the quality of patient care, and increase access to healthcare services. These strategies support a better balance of the Iron Triangle by improving cost management, quality outcomes, and patient access simultaneously. Healthcare leaders play a critical role in addressing staffing shortages. Effective leaders create supportive work environments that encourage teamwork, employee engagement, and professional development. Leaders who communicate openly with staff and recognize employee contributions can improve morale and reduce turnover. In addition, healthcare administrators are responsible for making strategic decisions that balance financial constraints with the need to provide high-quality patient care. This includes evaluating staffing levels, budgeting for recruiting efforts, and investing in employee training and wellness programs. Strong leadership also involves planning for future workforce needs and adapting to changes in healthcare environment. By supporting employees and promoting a positive organizational culture, leaders can improve retention, strengthen patient care, and help maintain a balance between cost, quality, and access. Staffing shortages can have lasting effects on healthcare organizations beyond the immediate challenges of scheduling and patient care. When employees consistently work overtime or manage heavier workloads, they are more likely to experience burnout and job dissatisfaction. These often lead to increased turnover, creating a cycle in which organizations must continually recruit, hire, and train new employees. These activities require significant financial and administrative resources. Staffing shortages can also affect organizational culture. Employees who feel overwhelmed may experience lower morale, reduced engagement, and increased stress, making it more difficult to retain experienced healthcare professionals. Over time, these challenges can impact patient satisfaction and organizational reputation within the community. Healthcare leaders must take a proactive approach by investing in employee support, workforce planning, and retention strategies. Addressing staffing shortages today can improve long-term organizational stability while supporting better patient outcomes. In conclusion, staffing shortages remain a significant challenge for healthcare administrators because they affect every aspect of healthcare operations. Through the Iron Triangle model, it is clear that staffing decisions have a direct relationship with cost, quality, and access. Staffing shortages increase costs through overtime, temporary staffing, recruitment, and training expenses. They also decrease quality by contributing to employee burnout, increased workloads, and potential impacts on patient safety. In addition, limited staffing reduces access by creating longer wait times and fewer opportunities for patients to receive timely care. Addressing staffing challenges requires a strategic approach that focuses on recruitment, retention, employee support, and effective workforce planning. Healthcare leaders must balance financial responsibilities while ensuring that patients continue to receive safe, high quality, and accessible care. Investing in the healthcare workforce is essential for improving organizational performance and creating a sustainable healthcare system.